Hello, in this video I'm going to be talking about radiation therapy. Why is it used, what's it good for, and what to expect, especially with your first treatment. Before I go on, I'd love to invite you to subscribe to our YouTube channel. We're always putting out new content, often because you've asked us questions or made a request in the comments below. I'd also love to invite you to go to Yerbba.com to get your personalized report to learn about the types of treatments you might be offered and the pros and cons for each. Now, let's say radiation therapy is part of your treatment plan and you've never had radiation therapy before. I'm going to be talking about what to expect after your first consultation. So your consultation, you'll meet with a radiation oncologist. You'll learn about, in your specific case, whether radiation therapy is indicated, meaning is this a good thing, or is it not indicated? That's your consult. If you are going to proceed with radiation therapy, you'll have an appointment called a simulation or treatment planning. Simulation equals treatment planning. It's the same thing. Simulation is just jargon. And we use a lot of jargon in medicine, as we probably do in your life as well, outside of medicine, or maybe you're in medical care. You know we rely a lot on jargon. So what is the simulation? The simulation or planning is done with a CT scan, and it's done with your body and the radiation machine on a special machine to help plan out your treatment. What we want to do is treat the areas of interest, the breast or the lymph nodes or the bone, the areas that have cancer in them or might have cancer in them. And we want to avoid the normal tissues, like if it's your breast, the heart and lung and the bones. And if it's your spine, we want to avoid your GI tract, your stomach. So we do a lot of planning to try to make sure that we're as specific as we can with where the radiation therapy goes, and we protect the normal tissues as much as possible. Now, between your simulation and starting treatment, the physicists who work with a radiation oncologist are very busy creating a radiation field that does exactly that. So simulation will be on one day, and your treatment may start a few days later or even a couple weeks later, especially if you're still healing from surgery or still recovering from chemotherapy. And that time is being used not to make you twiddle your thumbs or tap your feet, but rather to get the absolute best treatment. If you're getting treatment, for example, to the base of the brain, you may have a mold created for you that allows your face and head to be held in exactly the same position. Molds are not always used, but for areas where targeting that area is really, really important, we want to do everything we can to ensure you're in the same position every day. Now, when treatment planning is done, you may have some marks put on your skin, either with a semi-permanent marker or sometimes with tattoos. These are tiny little dots that make sure the machines are lined up just perfectly, so all that work that was done on your planning visit can be brought to bear, so that the machine goes to the exact area, and even more important, that energy, the radiation goes to exactly the same area, and we avoid things like scatter, where the radiation beam spreads out. So those skin marks are done to align the radiation beam exactly in the right spot.
Diagnosed with breast cancer? Meet Yerbba, your guide to personalized treatment options. Each option is specifically tailored to the unique characteristics of your tumor. Sign up today at Yerbba.com to take control of your breast cancer journey.
Radiation therapy is really good at killing cancer cells. While you might wonder, what about my normal tissues? Yes, it affects the normal tissues. We don't want to minimize the side effects and the adverse effects on normal tissues. However, it's much more powerful against cancer cells than it is those normal cells. So radiation therapy can treat the area where the cancer was, where the cancer is, or where we worry the cancer might be. So for people with breast cancer, it can be used after lumpectomy to treat the rest of the breast, to make sure we do everything possible to keep the cancer from coming back in the breast and the neighboring lymph nodes. So in that case, there's no evidence of disease, but we want to make sure that it doesn't come back. And while there's no guarantee, radiation therapy is very effective in reducing the risk of cancer coming back in the breast and in the neighborhood lymph nodes. Sometimes in people with mastectomy, especially in people with a big tumor, a close margin, or positive lymph nodes, we give radiation therapy as well. And it's given in people who've had a mastectomy to decrease the risk of the cancer coming back where the cancer was, meaning around the incision, in the skin and the skin flaps around the incision, or if you're going to have reconstruction, to keep it coming back in the reconstructed breast. And again, to decrease the risk that it's going to come back in the regional lymph nodes, the lymph nodes under the arm or above the collarbone or behind the breastbone. We want to treat that whole area to decrease the risk markedly of it coming back. We also use radiation therapy in areas that are known to have cancer. So in people with very small lymph nodes, for example, under the breastbone, radiation therapy we can use to treat those cells without having to do surgery. And if cancer is in other parts of your body and it's causing symptoms, or there are very few parts of the body with cancer, we can often treat those with radiation therapy as well and prevent symptoms, decrease symptoms, prevent fracture in the bone, for example, and make it possible for you to have a good quality of life. So you can see radiation therapy is used for a lot of different reasons. I've covered a lot. I hope this has been helpful. If you have questions or you have tips about your very own planning day, what it was like for you, we love hearing from you. Just pop that in the comments below and we'll get back to you within 2 weeks. Whenever we can, we get back to you just as soon as possible. Thank you for watching, as always, and we'll see you next time.